Class 2, I hope y'all doing great. So I just collected some PSA tips and tricks on the exam day. So I'll go, in case everybody's familiar with what BNF is, first I'll just go through the quick tips and tricks. If they ask you a certain type of question, for example, what do you search what do you literally type in there? Because sometimes when you search something, it won't come up. So I'll go through them quickly, and then afterwards, if I'll explain them in more detail. So in case people it's their very first time and have absolutely clueless about what to search or like what these are, I'll explain in depth later. But let's just go through a quick one. Of course, I just type in BNF here. The website comes and this is what I use. You can go through here, or you can use Medicine Completes as well, if you wish. But on the day, you have free access to it anyways, and you can just click there. Anyway, so I just have my BNF open. If any question ask about a steroid conversion, for example, you want prednisolone, change it to hydrocorticosteroids or hydrocortisone, for example, IV. What do? This is what you search. You just literally type in up here, you're going to type in gluco, and if it actually comes, you just put glucocorticosteroids, and there you go. You just click on that and it comes. Next one. If any question asks you about bleeding or they're giving you some sort of an INR, I literally just go here into the treatment summaries as it's coming. You just search in anti-coag and it literally comes. Click here and then you can see the question. And I usually search in here INR and I press a couple enters and I just scroll down. And this is the section I want. For example, the patient is bleeding. This is the INR. What do? I just look up what INR it is, but just make sure you have actually read this page as well. Okay. Next, if a patient's overdosing on anything, and if it's paracetamol, everybody knows that you can just type in paracetamol here even. But if it's like a harder medication, just type in poisoning. And it literally comes in here. So you just type in poisoning. And guess what? You get all of these. And you can choose whatever you want. Let's say if it's paracetamol, you click on it and it takes you there and you know it's N-acetylcysteine. So this is an easy example because everybody knows it. But if it's any other medication, any other poisoning, any other overdose, this is what you do. So you search in poisoning like I put here, okay? If the questions ask you about anything about HRT, I want you to type in up here. Let's just delete that. You just type in here sex hormones. There you go. You click on there. And voila, there is your, you just click on it and then it comes. Just a little trick about HRT. What I normally do, control find, and then I search uterus. Uterus. There we go. Because sometimes the treatment is important if the woman still has her uterus or if they've removed it. So I usually do uterus and I enter a couple of times. As you can see, a woman with uterus, this is the treatment, and then woman with a uterus again, or here without. So what do you give, with or without? So this is just another tip for you to know. Then next, what's next? If they ask about anything about hypoglycemic event, meningitis, seizure, any of those, and then sometimes I find, for example, for meningitis, when you search here, nothing shows meningitis. It doesn't come. And even when I search it, it doesn't come. And then during exam, you kind of get panicky. So if you get, just remember anything about all these documents below, just click medical emergencies. So just put medical and it just comes. Medical emergencies, they're really the first one. Let's get rid of that. And as you can see, as soon as it comes, you get all of these, for example, hypoglycemia, seizures, and all of that. And guess what? Just control search here. Put meningitis, and voila, there it is. But if you search meningitis on the BNF on its own, I can't find it. This is how you find it. So on the day of the exam, don't panic. Just go under medical emergencies and click find. Or you can just put crew. See, it just comes, it brings it up. But crew, actually, if you search it on its own on top here, it brings it. But meningitis, every time I do, or even hypoglycemia, when I type hypoglycemia, it doesn't come. But from here, it comes perfectly, because if you take a look, you get even the breakdown. What if the child is on up to 5 years old? What if it's above 5? What if it's between 12 to 14? It just brings it up. And if the patient can eat, fine, by mouth. If they're vomiting, can't take anything down, fine. You might consider buccal injections as it goes. This is very common. Or glucagon injection, or straight off the bat, if they're asking you to prescribe fluids on the exam, guess what? These are your best friend. You either go glucose 20% intravenous infusion. I always put 100. It's easy, over 15 minutes, or you can do 10%. Either or of these will work as well. All right. So this is for any hypoglycemia. So there might be like, oh, the patient is diabetic, And we did the glucose test. The BM or glucose fingerprint test is around 1.2 or 2.1. This is very low. It is an emergency. Brain consumes glucose, so you got to treat it like one. So if you get any questions like hypoglycemia or anything like that, again, you go through medical emergencies and you, like on top here, if you go look, you literally click hypoglycemia and you get that. If it's a seizure, click on seizure. It tells you exactly what the first line is, and depending on the ages and if the patient can tolerate it or not, right? So it's really good summary. I want you to go through this, or if it's a coronary artery like a ACS, again, you can see it's all there. Meningitis is not here, but if you search fund meningitis, like I mentioned, it comes. All right. Next, you got drug conversions. If they want analgesia antiemetic, just click and search palliative care. So I just literally come here, and let's get rid of that. You just put palliative, and there it comes for palliative care. The most important thing is the conversion drugs. You need to know, for example, how one drug is converted to another. Let me just scroll down. These are the most important. So they have some guy is taking, for example, oral morphine. This is, for example, they're taking 60 milligrams, but it won't be as easy as this. They tell you, oh, they're taking this and this. You just have to add it together to see what's their total in their 24 hours. Then once you get this, and they might be like, well, what can we convert it to in terms of the other drug or other type or other form, if it's an infusion of subcutaneous? Well, what is that equivalent to? So you get the total. If, for example, it was 60, then you know it's 20 milligrams for subcutaneous. They will ask questions like this, or they can ask about patches. They can ask about buprenorphine. What's a conversion from this to this? So you have that right here, and you can convert it, okay? Next one. Sometimes they might ask which one of these drugs can cause, for example, QT prolongation. Now, this is not a drug-drug reaction, because if it's an interaction fund, you can just go in here and you literally prescribe interactions. You find the drug, for example, that you want, or you can just go through here if it's like Acorbus, and then you can just click on this is the interaction, and it's a huge list, and you can find and search, for example, any drug, and it will highlight it. But some people like complete medicine because you can just do the same thing. You can type in interaction and complete medicine. I think that's actually a lot easier. So for interaction, I really recommend you use the medicines complete, because this might be a little headachy. Regardless, if now you wanted to, for example, know multiple drugs, what all of these drugs, for example, cause QT prolongation. So this is how you search it. You literally type in QT here. You put QT prolongation, and you put and in capital, open bracket, for example, drug A, whatever it is, type it, and then or, space again, drug B, whatever it is, type it, and then put or again, and then drug C, whatever it is, again, type it, and close the brackets and search. Once you search, you actually will see it says this drug causes QT prolongation, that other drug causes QT prolongation, and so you don't have to search one by one. It's like a sum of everything. It's really neat. Okay, so just do that. Also, if you're absolutely clueless and you don't know what, for example, the person has some sort of you feel like they have an infection, you want to give antibiotics. Honestly, just type in antibacterial here. And it literally comes. I usually call prophylaxis, and then look at your question. What does the question? If it's a pregnancy, I just type pregnancy, and it straightforward goes through it. I know what to do. If it's a UTI, you can type that. If it's if it's rheumatic fever, for example, what do you prescribe for that? It's phenoxymethylpenicillin. So with the rheumatic fever, the question would be like, oh, the patient comes in, she's probably a young kid, sore throat, fever, chills, and all that goodies. And then the strawberry red tongue, that's just a dead giveaway that this is a rheumatic fever, and then this is where you find the treatment for it. But I think if you put rheumatic fever, but be careful with the spelling. You gotta type it exactly like this for it to show. But in the exam, you're trying to be fast. You might panic. Honestly, I just put antibacterial, and then I just put fever. I don't even put rheumatic. I just put fever, and then it just comes. Because sometimes when you're trying to type fast, you make a lot of mistake. Imagine if you just want to type, oh my god, rheumatic, like if there's a spelling issue, you can't find it and you get flustered. So I just put antibacterials, this comes, and I just literally search fever, and voila, it comes. You click on it and you see, for example, what that is. Mist pills is a very common question that they can ask you. You literally, for example, you type in mist pills, and it will bring you already a bunch of different medications for ladies that they have to take. If you know exactly what they're taking, I suggest you type in the medication first. So for example, if it's desogestrel, let's say, then you know this is what they're taking and they forgot it. So first, just if you know it right off the bat what it is, click on it, and the page opens up, and then I literally here, instead of fever, I control find, I put mist, and then I put another enter. So there you go. This is your mist pills. If they miss the first dose or second dose, what do? And you just follow whatever it is. And different drugs have a different section. For this question, if this is especially in your first 8 questions, put time on it to actually learn what it is, because it's really good and easy. You just read it and say it. NMS, neuroleptic syndrome. So if they ask you something like this, make sure you know the difference between NMS and serotonin syndrome. One has tremor, one doesn't. So make sure which one is which. One is acute onset, one is prolonged onset. So just make sure you know the differences. And if they ask you, sometimes if you search it, again, you put it in wrong spelling, it might not come. So you're going to search instead psychosis. There you go. You literally search psychosis and related disorders. When you click that, the page comes in, and I put neuroleptic, and then the second enter, when I press, it literally is the neuroleptic. I just go down, and then I see, well, there you go. If they get this is your treatment, you can give this or dantrolene, and ta-da. But sometimes, again, if you want to put neuroleptic, if you misspell, you can't find it. Just so you know where to find it, this is what you search: psychosis and related, like I did on top. There you go. And then I just put control find. I just put neurolep the second, and I don't even have to press the whole thing or search the whole thing. Neurolep is enough. I find it, and voila. These are the 2 medications to give if the patient get it. If it's serotonin syndrome, again, you can actually just search serotonin syndrome, or you can put, so they might say, for example, a patient has a history of taking medications that are antipsychotic medication. All of a sudden, they're rigid, their neck stiffness, they might have tardive dyskinesia, or like all of that they could say. So you can clearly see that the type of side effects that they're getting is from the medication. So in that case, what do? You actually search. You can put dystonia, for example. Let's see if that counts. You could put dystonia, and procyclidine is actually the proper one. There you have it. So it's actually the first one it comes. Or you can put Parkinsonism. Parkinsonism. I put ism because it's not the Parkinson disease, this scenario that I explained to you. It's a side effect of it. And again, Parkinsonism, it's the procyclidine. Make sure you know this. This is worth memorizing. But if you don't memorize it, well, guess what? You can just search it, and procyclidine comes. It's the third option down anyway. So so that's the other one. If they ask you anything about adrenal crisis, so they'll probably show you some lab values where potassium is different, blood pressure is probably down. So you just look at it and you realize that this is adrenal crisis. So you just search adrenaline insufficiencies. It actually comes. Right, there we go. Adrenaline. I think I'm in, should be in treatment somewhere. Adrenaline insufficiencies. Oh. There you go. So then, with adrenal insufficiencies, you kind of give hydrocortisone. So it's steroids pretty much. Okay, next question. Pain. Of course, it's pain. For the pain, if it's a normal pain, you use the WHO ladder, so WHO ladder. However, if it's a different type of pain and you think it's neuropathic, and it could be something like a trigeminal, or neuralgia, or jaw pain, or diabetes mellitus neuropathy, or HIV. So in that case, I want you to do search a neuropathic pain. There you go. So if you search this, and if you think that that's, for example, trigeminal or whatever, it actually brings it for you. Trigem. There you go, for trigeminal. So if it's neuropathic, it should say diabetes. There you go. I literally just click on those, and then you can see which one is which. And last but not least, with venous, guys, venous thromboembolism, they really love that question. So I just put venous here, venous thromboembolism. It comes, you're just going to click on venous thromboembolism. They really like this question because they can confuse you. They either ask about prophylaxis or treatment. Make sure if it's a treatment dose, if it's confirmed, for example, they did an ultrasound or a Doppler, there is a DVT, there is elevated D-dimer. In those cases, you know for sure you got to go for treatment and not for prophylaxis. So you just click on treatment. And when you click on treatment, so this is non-treatment, go down, there you go, the first drug you see, voila, apixaban or rivaroxaban, that's what you choose. However, if they say, oh, we're giving it prophylactically to prevent, fine, then in that case it's different. You can give enoxaparin, fondoxaparin, so you put prophylaxis, and there you have it. It tells you it's, this is for surgical patients, is usually here. It says it's unfractionated heparin, because that higher dose. I usually, for surgical patients, after they come in, even in normal practice in a hospital, we usually give 40 milligrams of enoxaparin. And here's, you can see it, enoxaparin. So you just know when they say low molecular weight or unfractionated, what you need to search. So in that case, for example, I put enoxaparin, right? So it comes, and I go indications and doses, and there you have it. And then I just put surge. I just surge. I know it's a surgery. And then I just look, I keep going, scrolling down. All right, so it was just up here then. So these are the ones with surgical patients. And then I look to see if there's any orthopedic or high risk. So DVT, especially surgical patients, high risk and orthopedic surgery. Voila, this is what you're looking for. So you know for sure it's a 40 milligrams, and that's what you're giving. Alrighty. And of course, fluids. Fluids is a big topic. If you like, we can go over it later on. So it will be like a fluid maintenance. It could be maintenance fluid, or it could be resuscitation fluid. And of course, there's the one with diabetes, fixed rate, if they're in a DKA as well. But we can just learn the normals. We can do a different video if you like. Just let me know, and then we can do another one as well. So, but there you have it. So there you go. If they ask you questions about anything on the left side, this is what you search in the BNF on top here. All right, so let's just go through it again. Steroids, this is what you search. Bleeding, just search anticoagulation on treatment summary. Overdose, poisoning. HRTs, you search for sex hormones. Any of these, when you're panicking, you don't know which one is which, because sometimes if you search for any of these, you might not get the right answer. Just go first, clinical emergencies, type in here first. Then you search that word, hypo, meningitis, seizure, whatever it is, and you'll find it. Any of the drug conversions from especially morphine, anything with the codeine, these are all regulated drugs. You search palliative care. If, for example, they say all of these drugs, which one of them, all of them, for example, together cause QT prolongation. So you put QT prolongation and you put the drug or another drug, or, so this is the format you search in BNF. Antibacterials, if you're absolutely, because again, you're in time crunch, just put antibacterial, search it, and then search, for example, if it's preg for pregnancy, if you want to search for UTI or whatever it is that the question's asking. For missed pills, either if you know exactly what the medication is, type it in and then search missed pills after. NMS, search psychosis and related disorders, adrenaline or adrenal insufficiencies, but you already know the answer is always probably prednisolone or some sort of hydrocorticosteroids. And again, if the patient is sick or they're going under surgeries, there's more stress going on, so you probably have to double the dose. But it's all written in there as well. For pain, you use the WHO ladder, or if it's a neuropathic pain, like a jaw trigeminal, diabetes mellitus neuropathy, you can just search neuropathic pain up here. And then venous, we talked about that as well. All right, guys, I hope that really helped. And just a quick thing, this is the prescribing safety website. You just go into Google, type in PSA exam, this comes in. I'm already signed into my account. So here you're going to log in. And then once you log in, you click on assessments. And then you do practice assessment. So on there, as you can see, you get a set of, you get a demonstrating paper. So I recommend you do this first. So this is the easiest. Then you get practice paper 1, 2, 3, and then do them timed. So that because then you realize how fast you need to be, and it's also good for practice. And then you can just, review your results later and see how you did. I really recommend you do all of these at least 1 or 2 or 3 times. Make sure you know them by heart before going in. And then you use just these techniques I told you in order to figure out what's what. Alrighty, guys, have a good one.